I don't have my brother anymore. Because he did not get steroids on time, we lost him. That really, really kicked me to change my system because we could have prevented that. The traditional medical care is totally broken. We put a Band-Aid on everything and we wait for crisis to happen, where we're taking care of person when it's too late. The health insurance card is not a health insurance card. It does not insure your health. It's a crisis management card. I often saw myself talking to patients and saying, I wish we met 10 years ago. My end goal is lowering the dose of sugar, stress, and hormonal imbalance and raising their energy, their vitality, and their longevity. You heal, you feel like a new person.
Welcome to the first episode of Lower the Dose, Season 1, Diabetes and Metabolic Wellness. Today, you'll meet Dr. Rangi, the physician, teacher, and the visionary behind this movement. We're starting right where the great transformation begins, with a story, because sometimes the most powerful medicine starts with a moment of realization. The story of a doctor who saw limits of traditional diabetes care and decided to reimagine what health could be. If you've ever wondered when prevention really begins, this conversation is where it all starts. Dr. Rangi, how excited are you to be here and for episode 1 and for finally bringing Lower the Dose to life?
Layla, I'm really excited. This is something I've been building for the last few years. And it's been my vision for a long time. And it's important for me to bring it to the world because care that I think everybody deserves and should have.
Absolutely amazing. So, speaking about that and feeling like everyone should have this knowledge and this access, I'm curious, what drew you to medicine in the first place? Was there, let's say, a defining influence or a family experience, maybe a mentor, or even a patient story that really sparked this lifelong commitment for you?
Yeah, Layla, I was born and raised in India in a very small town called Pilani. It's in Rajasthan, and it's a very small town, well known for its education, but the advanced medical care was almost non existent. We grew up in a joint family, and I had my cousin with me, and he would often fall sick again and again without any answers. He wasn't diagnosed with pituitary condition, which drew me into endocrinology later, um, until he was 21, and something that we should have detected in childhood. So that really left a deep mark on me, thinking that how can we make it better? And nobody else has to delay getting that care that somebody deserves earlier on. Yeah. So that experience
Absolutely.
never left me. And it made me realize how devastating the delayed diagnosis can be. And it planted a seed to become a kind of a doctor who could see early, somebody who could act early and prevent the suffering before it begins.
Absolutely. And being that it stemmed from a family member, I can definitely understand that drive in you to really, really be so passionate about what you're doing and helping others. And in those early years of your training and your practice, what did good medicine mean to you?
Once I finished my medical school and did my residency and my fellowship and felt good about the fact that I've, completed my training and from the best schools in India, I was in Lady Harding Medical College, and thereafter I went to Wayne State University, Detroit, Michigan for my residency and fellowship. I think that what really resonated and what was sort of drilled in was that you got to practice evidence-based medicine. Some studies have to be showing this works, this is safe. And I agree with that. Evidence-based is very important. However, just prescribing the right drug and fixing the lab numbers and doing evidence-based medicine does not take care of the person as a whole. And I really feel that we all deserve overall holistic care. We're looking at health as a physical, mental, and spiritual well being. And I often saw in my patients now that if I offer the standard of care that has been taught to me in medical school and residency and fellowship, I may fix the numbers. I may be practicing the best medicine, which is all approved and dictated by the standard of care for the patient, but the patient may not feel the best. So you're right. In my early training practice, I felt good medicine was taking care of patient as doing the evidence-based care, writing the right medications, and fixing the numbers on the labs. But it's a lot more than that.
Absolutely. There's definitely, I believe, a lot more that goes into, like you said, good medicine beyond just the basics of what you may have initially learned. There's so much more to it. And I'm curious, how did your upbringing, I know you mentioned a little bit about your upbringing and growing up in India, but how did your upbringing and your culture, or maybe even mentors, shape the way you see the role of a healer beyond just diagnosing a disease?
Yeah, growing up in India, healing was always seen as a service, not just science. It was about empathy, about being present, and about the balance in life. Even after moving to high tech endocrinology practice, I carried that belief that true healing means understanding the whole human being as a person, their stress, their sleep, their emotions, their hormones, and their everyday life that revolves around them, and not just their symptoms or blood tests. Um, Even now, I get patients who will say, I'm here to look at my numbers. Can you help me fix this? And I usually tell them to close their numbers and let's talk and understand where we are before I look at numbers, because you are more than your numbers.
Absolutely. And I think that there is a difference between just what a patient is going through and what you're trained to do to help them and what patients truly need and how you've evolved yourself to be more than just focusing on one thing, how you evolved your practice to really be inclusive of just one particular thing. So, was there a moment where you realized you were maybe seeing patients and I think you've said this before, it may have been 20 years too late, especially with patients whose blood sugar or metabolic issues had been building for years. What was really happening then when you thought maybe it's particularly too late, or maybe it's not too late?
Often questioned myself. I've been in practice now for the last 20 years, and including my training and total experience of 25 years. As a consultant, I would see patients after they had the heart attack or once their diabetes was totally out of control, and now we have to address it when the person has had couple stents, maybe had amputation, maybe has declining kidney function. So, in other words, I often saw myself talking to patients and saying, I wish we met 10 years ago or we met 20 years ago. And I think that resonated so much with me that over time I felt that instead of just telling these patients, I wish I met you 10 years ago, 20 years ago, I'm going to change my system in a way where I start meeting 10 or 20 years earlier rather than just telling them, because patients don't know that. They follow what the traditional medical care teaches them. And the traditional medical care is totally broken. And, we put a band aid on everything and we wait for catastrophe to happen. We wait for crisis to happen. Um, yeah. So, it hit me hard after years of seeing patients who came to me after a heart attack, when we could have prevented that heart attack. The warning signs were always there. These people had high insulin levels, they had too much inflammation, they had imbalance in their hormones, they had visceral fat, which is a fat around your organs, not just the outside fat. But no one connected the dots until it was too late. And I started feeling like I was putting off fires all the time, that could have been prevented. And I remember thinking that we don't need more emergency rooms to fix problems. We need more early detection rooms where we can help people map their health, create the roadmap to a vibrant living, or create their health journey so that they can understand based on their risk factors, based on their family history, based on their stress. How can we pivot those and change those so that we can give them the best life possible?
Absolutely.
Yeah, that realization changed how I practiced medicine forever.
With that realization, was there maybe a specific patient or even an event that really became that wake up call moment when you knew that the system just had to change?
Thank you for asking that. I think it was not just one event. I think it was a sequence of few events that have happened in the last 5 to 10 years, I would say. Certainly, COVID was one of the big moments that made me change things because I saw how fragile our system really is. And it's reactive, it's fragmented, it's built around crisis care where we're taking care of person when it's too late. Around the same time, I had my cousin who I talked about earlier growing up. We grew up in the same household. And he had a pituitary condition, which is totally manageable, if not reversible, because you're born with some hormone deficiencies and we can totally replace those. And I take care of those patients here in my clinic in Folsom, California, all the time. But one thing I always worry about is that if they don't get the right medication at the right time, especially when they're going through some crisis, there's a risk of Addisonian crisis, or adrenal insufficiency. And that's exactly what happened to my brother. He had some infection that happened. He lived in Jaipur, India. He had some infection that could have been healed or taken care of, but as a risk of the complication, he got low platelets, and he had a bad sneeze that led to a brain hemorrhage. And because he did not get steroids on time to prevent the adrenal crisis, and because he did not get the imaging or the CT scan on time, we lost him. I don't have my brother anymore. And that really, really kicked me to change my system because we could have prevented that. We could have done better anticipating that, educating the doctors, talking about it, and taking care of it on time. And then since then, I've had another cousin who um, lost her husband to sudden cardiac death at 50. And two other family members have had their heart bypass or cardiac bypass around age 50. So I just felt there's too many preventable catastrophes happening, even around me, in my family, and in my people I know of. So there's not one event, but certainly if you ask me one event, it's my loss of my brother that I wish I could have saved him.
Absolutely. I'm so sorry to hear about your brother, and thank you for sharing that. And I know that that is definitely a big part of what keeps you going, I'm sure, and really drove you to be successful and have your own care model. And I just know in my experience in life, I've had certain experiences where, similar to what you say, things could have been prevented. And myself, I've worked in healthcare for numerous years prior to recently. And I couldn't agree more about what you're saying about how the healthcare system is pretty much putting out fires in a way, because so many things can be preventable, but the system is definitely broken in various ways. And things almost have to get to a point of being so bad before they're treated properly, and at that point, is it too late? Sometimes it is. So I definitely admire what you're doing so much, and it is definitely something I wish was more normalized because it is a very big issue in healthcare. And speaking about what's really driving you, how did you really decide to take that step away from a traditional model and really design your own care model?
Yeah, Layla, it started a few years ago, right after COVID and then loss of my brother. Then I started going through my own personal journey or crisis, you can say, when I was being a caregiver for 25 years for my elderly in laws. I was raising teenagers at home and full time practice. And I didn't see it coming, but it was almost like a burnout. And what really changed the direction of my personal health was menopause. And now I can think more clearly, but during that time, it was like walking through the clouds, and I could not understand why am I not feeling well. So that was my final push when I was going through my own health journey, that I realized it has to change. It is so personal. I've seen it myself. I've lost a brother. How long can I wait for? We got to plan things. We got to see things ahead of time. And it began as quite a conviction that there had to be a better way. Yeah, I started to imagine healthcare more like financial planning. You plan, have projects that you have to do, you protect before the crisis happen, and you keep your rainy day funds, and you plan how you're going to take care of things when you're not able to afford. And we all know that there's a check engine sign that is coming all the time. So I started talking to my patients about it, that, you know what, let's take care of other things which can be crisis eventually. And what I noticed was that patients are very much holding on to their health insurance. If I offer them something outside, they would always want to see if the health insurance covers the service or help. And that's when I decided that I need to change the mindset, and I need to talk to my patients and public and educate and empower people about why they need to think outside of this healthcare model. Because the health insurance card is not a health insurance card. It does not insure your health. It's a crisis management card. It just helps you take care of yourself if you're having crisis, to go to the hospital when you're having symptoms or heart attack, or you could pay for your surgery, or you could pay for doctor's appointments. But it does not teach you anything to create health. So I knew that I have to create a system that is completely out of this insurance based model, because if I just hold on to that, that is not going to serve my patients for things that I'm trying to create.
Absolutely. That's, I think, such an interesting way to think about it, as like what you said about the insurance part and being a crisis management card. That is definitely going to stick with me because that's so well said. I think it's such a good view on it because it's so true. And it goes back to how the healthcare system is broken and insurance, and it's just a wild, very confusing, something to navigate. It's hard to navigate. So I think what you're doing is very powerful, especially like you said, being a caretaker to your elderly in-laws and then also going through menopause and raising teenagers. I cannot imagine. I was a caregiver to my grandfather in my early 20s, and I know firsthand how hard it is to navigate the healthcare system based on that. And I wasn't raising teenagers and not going through menopause, so hands down to you because that's super hard, and for you to find power in that to take this by storm and do your own thing is definitely super admirable, and it's not easy to do at all. And with that, you started the phrase lower the dose, which I love. I think it's super catchy and the premise of season 1 here, but how did that phrase come to you? How did lower the dose come to you? Was it of a gradual evolution or was it one defining moment?
I was talking to a friend, and she happened to ask me, she said, "What are you really trying to do? I've heard that you're trying to offer wellness care to your patients. What does that wellness care entail? What does that mean? And, is it functional health that you'll be offering? Is it holistic care that you'll be offering?" And that's when I realized what I want to do is, my end goal is prevent catastrophe or prevent crisis, right? And how do I get there? How do I prevent crisis? Is by lowering the dose of everything that is pushing us towards that. And that is actually sugar, stress, and hormone imbalance. So I realized I want to offer people and educate them, and talk about lowering the dose of sugar, stress, and hormonal imbalance, and raising their energy, their vitality, and their longevity. And you don't have to work towards the right side of the equation if you just work on the left side of the equation. You just need to work on lowering the sugar, the stress, and the hormonal imbalance. And a lot of people think hormonal imbalance is is all reproductive hormones or sexual hormones. But what I want to make sure is everybody understands cortisol is a hormone, insulin is a hormone. So all these hormonal imbalances that happen with metabolic changes, that happen with age, with that get multiplied many times with menopause, and that happen with sedentary lifestyle. For more people like in their 50 to 75 is when you really need to hone in and lower the dose of your sugar, stress, and your hormones, or you can call toxins that are coming from outside world. It could be environmental toxins, with the end goal of preventing crisis or catastrophe.
Absolutely. And I'm super intrigued because I'm someone who's had these hormonal issues myself. So I'm definitely excited to learn more about this and episodes to come. But I'm curious when you say, for example, lower the dose of stress, sugar, and crisis, raise your life. What exactly do those three words mean to you philosophically and also emotionally?
Yeah, physiologically, those three, sugar, stress, and hormones, are what drive the disease, the chronic disease. Be it diabetes, be it high blood pressure, high cholesterol, weight, excessive weight, all those metabolic complications that are part of chronic health problems. The common denominator or the drive is stress, sugar, and hormonal imbalance. Um, Even if you look at dementia, or even if you look at cancer, I see patients all the time who would tell me, Doc, don't give me any drug or a medication that can give me cancer. And my answer is, of course, I'm not going to give you any medication or drug that would give you cancer. I don't intend to do that. However, being overweight, being obese, there's 13 kind of cancers that are possible. And that's been proven, and it's cdc.gov. You can look up there. So we're already putting ourselves in a high risk for all kind of health complications from the weight, and you add sugar and stress, sprinkle that with that, that's a recipe for any chronic health problem. So, physiologically, that's what I want to work on. They keep the nervous system in overdrive and hormones stay out of balance. They don't make you feel well. You're always tired. You're always having, cloudy memory. And when you lower them, the body feels so much better. You heal, you feel like a new person. It's also emotionally, it's about reclaiming your peace and your control. So, one of the pieces that I've added to my lower the dose is stress management. Because I always felt that when I offer the best care to my patients, I can get their diabetes under better control. But one thing they always say is, Doc, I have too much stress at home. Something or the other is going on. It could be their children, it could be their neighbor, it could be their spouse, it could be caregiving or whatever, right? So to me, lowering the dose of stress really resonated well with me because we need to be intentional about it. We cannot just say it, manage your stress, okay, go take care of that, or let's just try to eat better and lose weight. I want to be your partner. I want to be your coach. I want to help you understand based on your body type, how can you eat better? How can you manage your stress better? Because we do all this metabolic mapping and exercises or tests that we do earlier on. So that's why the sugar, stress, and hormones I found was the most important factor that was driving most of the diseases.
Absolutely. And is this something you come up personalized with each patient, or are there certain things that you recommend for all of your patients to help, for example, lower stress or lower sugar?
No, no. One thing that we thrive in lower the dose is we offer proactive, personalized, precision-based medicine, and that is for preventable care for things that you anticipate over time. So we do there's a term that I've coined called the healing equation. And according to the healing equation, we map first. So, based on everybody's special testing that we do, we call it precision 30. We do 30 tests that we do on everyone. We may add some more things based on somebody's risk factors. We do nutrigenomics, we do other kind of DNA testing, genetic testing, and we also do their other risk factor profiling. And that helps us understand where they are, and we develop the goals where we want to take them. And that's the first step that we do. And once we know based on their risk factors or their genetics, this is a plan that we have, then we implement it. So, yeah, to answer your question, we do very much personalized care and it is precision based for specific people.
It's amazing. I think it's great because everyone is so different. So being able to really offer that care and that insight on a personalized level is such a game changer for everyone who's receiving your help. And
How we, sorry to take your time, how we process our food or how we process our medications is very different, very individual. And we try to box everyone and we say, one size fits all. This is a medication for diabetes. Everybody should be on metformin. Everybody should be on these medications. And that's now how it works. That's not how it works. And we're learning more and more about it, how our genetics plays, how we detoxify, and how we get rid of metabolic waste or things that we process in our system. So we do need a process that is very personalized and specifically made for your body type.
absolutely. And your clinical work in diabetes gave you such a front row seat to how stress and diet and hormones really affect blood sugar. So, how did those insights shape the lower the dose framework?
After treating thousands of patients with diabetes, I saw the blood sugar is never just about food. Um, it's got a lot of stuff loaded up there. Yes, nutrition is huge, but how we take care of ourselves, what's our lifestyle, what is our sleep like? Because lack of sleep changes your hormones in your body. How's your daily stress? That changes the equation. What's your status of your hormones in your body? Because again, even though we know people with menopause have certain changes, but it could be more pronounced in someone versus somebody else because of the other health risks. So when people were anxious or exhausted in my diabetes care, they would spike even with a perfect diet. So you have to understand that stress, pain, lack of sleep, hormones, all those things matter. And we cannot just prescribe and let patients go. And that's what traditional medicine does. And that's a shortcoming. 10-minute visits, you come, you get the medication, out you go. And there's no way we can do a fantastic care in creating health in that scenario. Um, yeah, that insight really shaped Lower the Dose framework around three pillars, which we talked about: sugar, stress, and hormones. So we look at person as a holistic well-being, of the person, and we want to make sure that we manage everything that affects those three things, including your lifestyle, including your activity throughout the day, your sleep, your relationships, your stress, and so on.
It's so interesting that all those factors really play such a major role. I think most people who don't have the backgrounds or knowledge in this space really would not even think about sleep and all these things playing a role. You think about sugar, you think about what you're eating, like you said. And speaking about what you touched on earlier, you designed the Precision 30 testing and lifestyle program as part of your prevention first mission. So, how do these help patients move beyond managing diabetes to actually reversing the risk?
Yeah, so Precision 30 is a biochemical mapping. This is something I created, where I have created a set of 30 tests that help me figure out somebody's metabolic health, about their personal risk factors, about their genetic risk, and things like that. Precision 30 is a biochemical mapping of how the body functions. There are 30 tests, like I said. We do those in the first 30 days of when the patients are working with us, and that reveal what's happening at the cellular level, at the DNA level, how the body is functioning. And then we pair it with something called Core 10. I have 10 biometric assays that we do, or biometric measurements that we do, that is from wearing certain devices or wearables. And they give us how the body is mapping throughout the day, with your sleep, with your heart rate variability that tells me about your stress, We also do something called body composition and try to understand what somebody's specific visceral fat, that is the fat around the organs, like I mentioned, that is has causes more inflammation, more risk of catastrophes and heart problems. And then we put a continuous glucose monitor. We measure the weight and the nutrition. I'm sorry, movement, nutrition, etc. So one is biochemical testing with precision 30, and the other is using these core 10 biometrics. Once I have those mapped out for a specific person, um, together they create a full picture of the internal and the external health. And once I understand that better, I can help the patients much better. Patients see their data in this way and they become more engaged, and because it becomes very personal now, because they understand I'm not treating them just like any other person with diabetes or any hormonal imbalance. It's specific to them for their body. And they shift from being fearful of their health problems to being more empowered, because now they have tools in their hand that they can monitor every day, they can change every day, and we will teach them and provide them what they need for their body type. That's how you move from control to reversal. And one of the programs that we've created is the diabetes reversal in 6 months. And that really helps turn the insight into daily action. And I'm looking forward to helping more and more people.
Wow, absolutely. And with these patients, or any patients in particular, we kind of touched on earlier how the healthcare system is, in a way, putting out fires. So it's not always about, it's versus, it's trying to get patients to be proactive versus reactive in certain situations. So is it hard, or is there a specific hardest part about convincing patients or even peers to see medicine through this proactive lens versus trying to put out a fire?
Yeah, thank you for asking that question. I personally feel it's going to take some time for us to educate public about it, and of course my peers. But I feel really sorry for my peers and for our health system because they have no choice. This is what we've been taught in medical school. You diagnose a problem and you give the treatment based on the problem. That means nobody will walk into you asking for, how do I stay healthy? How do I prevent a problem? They're going to wait till the problem happens. And that's when they come to you, and then you just give them a knee jerk reaction is to give them a prescription. And then before you know, you're prescribing another medication to prevent the side effects of that medication. And then you're doing more, something I call prescription cascade. And that's what I totally don't want my patients to have. I want them to be on least number of medications. And that's what I do in my everyday practice. I try to take them off of medications as much as possible. So we need to change the thinking of public and the peers as well, that having more medications is not the goal. Fixing a lab is not the goal. Um, and just thinking that healthcare card is going to take care of me is not the goal. Those are my hardest parts to convince people and help them understand that there's bigger reasons for you to take care of yourself. You want to live your best life possible. You want to live as vibrant as possible. And there's so many possibilities you could do it. And you got to just work with the right people who can guide you based on your health and your body type and your risk factors, how we could pivot or change or avoid that, or how could we take you off of prescriptions.
Absolutely. And I think that I can understand why that would be hard when you're taught a certain way or used to something very specific, to change that framework, to change the way of thinking and the way you function. So I definitely can see how that would be challenging. And now that you've been so successful, you've created all of this, you've treated, like you said, thousands of patients. But if you could go back and speak to your younger self, the one just starting your residency, what would you tell her about what health really means?
I think I would, if I were to create the curriculum again, I would do that, whatever it takes. We need to teach residents and fellows and medical students how to look at holistic well-being of a person, how to see the person beyond their blood tests, how to see the person beyond their diagnosis of certain conditions. And one thing I did not mention earlier that is very important is ICD codes. Health system will pay the doctors or will compensate for the care that you give if you have a ICD code for certain diagnosis. That means everybody who walks in my practice has to fit in a box, has to fit in a diagnosis. And I think that is not the right way to look at because I want to catch them before they fit in the box. So my message to my younger self is look at the person and as a holistic well-being. Think of band-aids for crisis and for accidents, not to take care of them on everyday basis. You need to help people stay mentally, physically, and spiritually healthy, aligned with their life and their goals, and have more meaning to their life than to just go to doctors and get the prescriptions.
Absolutely, absolutely. And I'm sure looking back at your younger self, you must be so proud of where you are now. And it's amazing that you did have this realization that is beyond just prescriptions and this framework that you were taught and expanding your thought process to everything that you encompass and really looking at it from a holistic approach and looking at people for their whole being versus just the one specific thing that you were taught. So that's amazing that you were able to do that. And
And
thank you.
one thing I wanted to add was we don't teach students and residents to be healers. We teach them to be reactionary to the situation. I want to be a healer for someone. I want to look at that person as overall well-being, and I cannot do that unless I'm trying to look at it in multi dimensions and help that person feel better and get better.
Absolutely. And that's so important in a provider. And I think that everyone who's ever been to a doctor would appreciate that. And those who you do treat are definitely very lucky and fortunate to have a provider that cares so much and thinks about, again, the bigger picture and wants to be a healer because that is such a life changing experience for a patient. So, thank you so much for all it is that you do, and thank you for talking with me today. And for everyone listening, I'm sure you've given them so much valuable information as well. And thank you for sharing where this all began for you from your early years in medicine to the moment that you realized prevention has to come first. So, if today's story inspired you at all to take that first step, book your free 15-minute discovery call with Dr. Rangi, and the link will be in the show notes. You will be able to go ahead and click that link to book that discovery call. And until next time, remember, you can't always control life's pace, but you can lower the dose and raise your life. This is Lower the Dose, and we're just getting started. Thank you so much.